Hi, everyone. Thank you for tuning in to today's second presentation in our clinical education series. Today's topic is drug utilization review. As you will hear from today's presenters, drug utilization reviews, or DURs, play a crucial role in improving patient outcomes by preventing adverse drug reactions, ensuring medication compliance, and optimizing drug therapy. My name is Shannon Thompson. I'm a pharmacist by trade, and I currently serve as the Program Design and Implementation Specialist here at Genoa Healthcare. I've had the extreme pleasure of working with Sarah Malik and Kristen Powell, who will be your presenters today. Without further ado, I will turn the presentation over to Sarah.
Great, thank you, Shannon. My name is Sarah Malik, and I currently serve as the Director of Clinical Pharmacy Practice and Accreditation for Genoa Healthcare. As a clinically trained pharmacist with over 20 years of experience across various pharmacy settings, I'm deeply committed to advancing healthcare quality and patient safety. It's a privilege to collaborate with teams that empower pharmacy staff to identify opportunities for meaningful improvements in patient care. Presenting with me today is my colleague, Kristen Powell.
Thank you, Sarah. Hi, everybody. My name is Kristen. I am the Director of Pharmacy Practice for Genoa Healthcare. One of the primary tasks in my role is to oversee Genoa's quality assurance program. I am also a pharmacist by trade, and I have been with Genoa Healthcare for 13 years. I started as a staff pharmacist, then moved into the pharmacy site manager role for a Genoa co-located in a local child and adolescent psychiatry clinic. I moved into my current role in the summer of 2021. I very fondly remember my clinic partners, and I'm excited to bring this topic to life, as our Genoa pharmacists are uniquely positioned with our clinic partners to manage DURs and promote safe patient and care.
Great, thank you, Kristen. And before we begin, both Kristen and I have no disclosures to report. All right, so in this presentation today, we will cover the following learning objectives. We'll start with the definition of a DUR and describe some relevant examples in the pharmacy setting. Then we'll discuss common DUR types and their impact in the evaluation of the drug therapy. We'll also describe a typical pharmacy workflow and how DURs are usually presented to the pharmacist. Then we'll share how the pharmacist evaluates a DUR to identify necessary action. We'll summarize some barriers that could impact care delivery to the patient. And lastly, we'll describe the role of pharmacy staff as part of the overall care team. But to help illustrate the drug utilization review process, I'd like to begin by sharing a story about Mary. Mary is a 65-year-old woman with a history of heart disease and anxiety. She visited her local pharmacy to refill her prescriptions. And in speaking with pharmacy staff, she mentioned she had been feeling unusually fatigued and dizzy, but attributed to her age and some changes in her family. Additionally, Mary was experiencing increased anxiety and difficulty sleeping, which she hadn't mentioned to her doctors yet. During the routine drug utilization review, the pharmacist, John, noticed a potential interaction between Mary's new blood pressure medication, her existing heart medication, and with her anxiety medication. Concerned about the combination, John decided to delve deeper into Mary's medication history and her current symptoms. So now that we've set the stage for the focus of today's topic, we'll revisit the story of Mary and John later in the presentation. So let's begin with a definition of a DUR. Now, while some of our audience may be familiar with the term DUR, we want to ensure that we have a clear definition as we speak about this topic today. So drug utilization review, or DUR, is an authorized, structured, and ongoing review of prescribing, dispensing, and the use of medication. It involves a comprehensive evaluation of prescription and medication data both before, during, and after dispensing to ensure medications are used safely and effectively, ultimately leading to better patient outcomes. Overall, DUR programs are essential for maintaining high standards in healthcare as they provide corrective actions, prescriber feedback, and further evaluations to improve the quality of drug therapy. Next, Kristen will describe the 3 types of DUR that are prevalent in the pharmacy setting.
So as Sarah mentioned, drug utilization review can be classified into three main categories. These are prospective DUR, concurrent DUR, and retrospective DUR. Each plays a unique role in the medication management process, helping healthcare providers ensure optimal outcomes for our patients. I'm going to broadly introduce the topics and then spend a little bit of time digging into each one further. So let's begin with prospective DUR. This type of review takes place before a medication is dispensed. It evaluates a patient's planned drug therapy to identify potential issues in advance. By catching these issues early, prospective DUR helps to prevent adverse drug events before they occur. Next, we have concurrent DUR, which occurs during the course of treatment. This involves real-time monitoring of drug therapy when the patient is actively receiving care. It's especially useful in hospital or long-term care settings where adjustments may be needed on the fly. This ongoing oversight helps ensure that therapy remains safe and effective throughout the treatment period. Finally, we have retrospective DUR, which this takes place after the medication has been dispensed and used. This review analyzes patterns in prescribing, dispensing, and administration to identify trends that may indicate inappropriate use or abuse. Retrospective DUR is a powerful tool for quality improvement because it allows us to learn from past behaviors and outcomes to improve future practices. In the next couple of slides, we're going to delve a little deeper into each DUR type. Community pharmacy, like Genoa, primarily focuses on prospective DUR. And as mentioned, this is the evaluation of a patient's drug therapy before the medication is dispensed, and it proactively helps healthcare providers to identify and resolve potential issues that could affect patient safety that could affect patient safety and treatment efficacy. Let's delve into some key aspects of prospective DUR review. So first, this may involve clinical abuse or misuse. By reviewing a patient's prescription history, pharmacists can detect potential overuse or inappropriate use of medications, which can prevent addiction or other adverse outcomes. Next, we look at drug disease contraindications. Certain medications should not be used in patients with specific diseases. For example, a patient with asthma should avoid beta blockers. Prospective DUR ensures that prescribed drugs do not exacerbate existing medical conditions, safeguarding patient health. Next, we look at drug dosage modifications. Proper dosing is crucial for medication efficacy and safety. Prospective DUR involves verifying that the prescribed dose is appropriate for the patient's age, weight, renal function, and other factors. This helps prevent underdosing or overdosing, which can lead to either treatment failure or toxicity. We also look at drug-drug interactions. So when we have two or more different drugs interact, they can alter each other's intended effects, often causing adverse events. Prospective DUR allows the pharmacist to recommend alternate therapies or adjust dosages to mitigate this risk. Next, we have drug patient precautions. Certain patient characteristics, such as age, allergies, and pregnancy status, require special consideration when prescribing medications. Prospective DUR ensures that these factors are taken into account, preventing adverse reactions and ensuring the safety of vulnerable populations. We also look at formulary substitutions, such as therapeutic interchange or generic substitution. These are common practice in pharmacy. Prospective DUR helps to determine if a formulary substitution is appropriate and ensures that the substituted medication is therapeutically equivalent to the prescribed drug. We also look at inappropriate duration of drug treatment. The duration of the drug treatment should be appropriate for the condition being treated, and prospective DUR involves reviewing the prescribed duration to ensure that it aligns with clinical guidelines and best practices. This may prevent issues such as antibiotic resistance or prolonged exposure to potentially harmful medications. Now let's take a look at the other two types of DUR, which may be less common, but definitely have an important role in supporting safe and efficacious treatment. Concurrent and retrospective DUR look at many of the same aspects as prospective DUR. The primary difference is the timing and the setting. Concurrent DUR helps to support real-time treatment monitoring for patients that are in some level of inpatient care. Examples mentioned before would be inpatient hospital treatment and long-term care settings. Retrospective DUR, which occurs after the drug has been dispensed, helps the pharmacist to evaluate treatment aspects or considerations that may have been overlooked in previous prospective DUR or were unknown or unidentified at the time of initial review. These types of DUR may involve reviewing drug-disease interactions, drug-drug interactions, drug dosage modifications, drug-patient precautions, over and underutilization, therapeutic interchange, appropriate generic use, and/or therapeutic appropriateness and potential duplication, in a similar fashion as prospective DUR.
So now that we've shared the types of DUR, let's explore why it matters and the impact in the pharmacy. As described earlier, the drug utilization review process has a significant impact on patient health outcomes by ensuring the safe, effective, and appropriate use of medications. According to sources, an average of 3.9 DRPs or drug-related problems exist per patient. On average, over $3.5 billion are spent related to hospitalization associated with adverse drug reactions. And in a study published in a peer-reviewed journal, Genoa's model showed an 18% reduction of emergency department visits and a 40% reduction in hospitalizations. This highlights the impact of pharmacists on the patient care team that are performing these types of vital drug reviews. So as you can see, these are just 3 examples of the impact of DUR activities, with many other examples in published literature. So what are some examples of how DUR can create that impact? Well, here's just 5 kind of types. So reducing adverse drug events. As Kristen described earlier, DUR really plays a vital role in identifying potential drug interactions, incorrect dosages, or inappropriate medications. By proactively addressing these issues, DUR minimizes the risk of adverse events, ensuring that patients receive safe and effective treatments. This reduction in adverse drug events leads to better health outcomes and enhances patient safety. But DUR also monitors and addresses issues like overutilization or underutilization, ensuring that patients follow their prescribed therapies. So by promoting medication adherence, DUR really helps patients achieve the intended benefits of their medications, leading to the better management of their health conditions. DUR also supports the optimization of medication regimens for chronic conditions such as diabetes, hypertension, and asthma. By continuously evaluating and adjusting treatment plans, DUR improves disease control and overall patient health. So this more proactive approach to disease management ensures that patients receive the most effective therapies for their conditions. DUR also evaluates prescribing patterns and educates healthcare providers, encouraging evidence-based practices that benefit patients. So by promoting rational drug use, DUR ensures that medications are prescribed appropriately and effectively, reducing the risk of unnecessary treatments and enhancing patient care. And lastly, DUR really contributes to more efficient healthcare delivery by preventing unnecessary treatments and hospitalizations. So by identifying and addressing the potential issues early, as Kristen described, DUR really reduces healthcare costs and ensures that resources are used effectively. So this more cost-effective approach benefits both patients and healthcare systems, leading to better overall health outcomes. Next, Kristen will explain where the DUR fits within the pharmacy workflow.
As Sarah shared, DURs have a significant impact, and as such, it is a process embedded in our workflow of every prescription. We wanted to take a chance to highlight how this actually plays out in our pharmacies. So every prescription journey starts with the pharmacy receiving the prescription, and we call this RX intake. We may receive the prescription in a variety of ways, including electronic, paper, or verbal prescription. Once we have the order, the pharmacy performs data entry, which is entering the prescription information into the pharmacy dispensing system. This is typically performed by one of our pharmacy technicians. Once the information has been entered, the pharmacy processes, or what we call adjudicates, the claim to insurance or processes the prescription as a cash pay consumer, and the prescription is then reviewed by the pharmacist. New prescriptions received at Genoa go through 2 pharmacist reviews. The first is what we call PV1. In this step, the pharmacist performs initial prescription review, which includes the pharmacist verifying that the prescription was entered accurately, ensuring it's valid and complete. And they perform their initial drug utilization review. The pharmacist checks for potential drug interactions, allergies, correct dosage, and the other elements that we reviewed as part of this prospective process. These DURs may be presented by the payer, the dispensing system's internal drug database information, and the pharmacist's knowledge of the medications and patient medical conditions. Next, we move to fulfillment. So once the initial check by the pharmacist is complete, the order is then sent into the workflow to be filled. This involves medication selection, labeling, counting, and packaging. Next, we complete the final pharmacist verification, which is a step that we also refer to as PV2. A second pharmacist check is performed after the medication is filled. Here, the pharmacist will ensure that the correct medication is being dispensed and has a second opportunity to review and take any action on DURs presented to them. Finally, we have patient education and consultation. Upon dispensing to the patient, the pharmacist may consult with the patient to provide information about the medication, including how to take it, potential side effects, and any other relevant information regarding their care and treatment. So we've talked about the types of DUR and where this fits in our process, but what exactly is a pharmacist doing when they perform and evaluate DURs? Let's break down the key steps involved. The first step in DUR is to thoroughly assess the patient's medical history, including medications, allergies, and diagnosis. Next, we analyze the prescriptions to check for correct dosages, frequency, and duration of therapy. It's essential to ensure that the prescribed medication aligns with the patient's condition and treatment goals. Third, the pharmacist is evaluating drug therapy, involving looking for therapeutic duplications or unnecessary medications. We also monitor for the use of overuse, underuse, or misuse of medications, helping to optimize the patient's medication regimen and ensuring that they're receiving the most effective treatment. Fourth, during the review process, our pharmacist may detect any adverse drug reactions or side effects that the patient may be experiencing. They also flag any discrepancies or deviations from established guidelines, identifying these issues early, which allows for timely intervention to prevent further complications. And finally, once potential issues are identified, we collaborate with prescribers to adjust therapy if needed. This collaboration ensures that any unnecessary changes are made to the patient's treatment plan. that any necessary changes are made to the patient's treatment plan. Additionally, we educate patients on the proper medication use, helping them to understand how to take their medications correctly and safely. And then lastly, of course, we document our findings and recommendations for future reference, helping to ensure the continuity of care. DUR is a key intervention for patient safety, and it does differ from other strategies in its focus and implementation. But let's see how it compares. DUR specifically targets the prescribing, dispensing, and use of medications. This helps to ensure they are safe, effective, and appropriate. Other interventions like electronic healthcare records or clinical decision support systems may address broader aspects of patient care, including diagnostics and treatment planning. Employing both prospective and retrospective DUR allows the pharmacist to address issues at multiple stages of care. In contrast, interventions like root cause analysis are typically retrospective only, focusing on understanding and preventing errors after they occur. DUR heavily relies on pharmacist expertise in medication therapy management, making this a specialized tool. Other interventions, such as team-based care models, involve a broader range of healthcare professionals. It also stands out in cost effectiveness, where DUR programs often include cost saving measures by preventing unnecessary treatment or adverse drug events. While other interventions like patient safety checklists improve outcomes, they may not directly address cost efficacy. And lastly, customization. DUR programs can be tailored to specific patient populations or conditions, especially in chronic disease management. Other interventions, like standardized protocols, may not offer the same level of customization. Overall, each intervention has its strengths, and they often work best in combination to enhance patient safety comprehensively. As with any aspect of healthcare, there are, of course, challenges and barriers that can hinder the effectiveness of the DUR process, which impacts patient care and medication safety. So let's explore some of the key factors and barriers that can impact any pharmacy organization and methods that Genoa has employed to overcome these common barriers and improve patient care. First, data accessibility and quality. Pharmacists often struggle with incomplete patient records or inaccurate data, which can lead to suboptimal decision making. We may also experience difficulty in integrating data from various sources, such as electronic health records and pharmacy management systems, which can complicate the review process. We also have time constraints and competing priorities, where pharmacists are frequently having to work with a high workload, which limits the time that they can dedicate to thorough DUR. Balancing multiple responsibilities can be very challenging. DUR must be balanced with other responsibilities such as patient counseling or medication dispensing, and these barriers may limit available time to complete really comprehensive reviews, especially if the data needed is not readily available. There's also a lack of standardized procedures and criteria for conducting DUR, which may lead to variability in how reviews are performed. Technological barriers may also present a challenge. Some pharmacies may lack advanced software tools that facilitate efficient and comprehensive DUR. Next, we may have educational or training gaps that exist, and these may be hard to overcome. Pharmacists may not receive adequate training in DUR methodologies or understand best practices, or have access or ability to engage in continuing education, which allows them to keep up with the latest developments in drug therapy and DUR techniques. And finally, effective DUR often requires collaboration with other healthcare professionals, which can be hindered by poor communication channels. Strong interdisciplinary coordination is really vital for comprehensive patient care. It also requires patient engagement and discussions about their medication use and adherence, which can be very challenging. Genoa is uniquely equipped to address several of these barriers to optimize patient care and support your clinic staff. Being co-located and in close working partnership with our clinic staff, Genoa teams can often overcome common data sharing limitations through provisioning access of the clinic EHR for those Genoa staff members. Additionally, Genoa prioritizes ongoing communication and relationship building with their clinical care team. This inclusive approach supports efficacy for everyone, including the clinic, pharmacy, and the patient. Genoa also works to equip our pharmacy teams with robust drug database resources and clinical support teams, as well as elevating our pharmacy technicians to practice at the top of their license, which allows the pharmacists to focus on clinical tasks and patient care. Genoa's high-touch care model also provides our pharmacy teams with the blueprint for more engaged patients. We work directly with patients and their caregivers to understand unique needs and challenges, and we find creative ways to meet and overcome those alongside them.
So now we'd like to return to our story of patient Mary and pharmacist John described at the start of this session. After performing the drug utilization review, John immediately flagged the interaction and contacted Mary's cardiologist and psychiatrist to relay the concern. After a brief discussion, they decided to adjust Mary's medication regimen to avoid the dangerous interaction, and they also addressed her increased anxiety and sleep issues. They prescribed a different anxiety medication that would be safer with her heart and blood pressure medications. John explained the changes to Mary, emphasizing the importance of monitoring her symptoms closely and encouraged her to communicate any new or worsening symptoms. He also provided her with some tips on managing anxiety and improving her sleep hygiene. A week later, Mary returns to the pharmacy looking much better. She thanked John for his diligence, explaining that her dizziness and fatigue had significantly improved, and she was feeling less anxious and sleeping much better. Hopefully, this story helps to illustrate how the drug utilization review had not only prevented a potentially serious health issue, but it also improved Mary's overall quality of life and mental well-being. So as we conclude today's presentation on drug utilization review, we wanted to highlight this topic to show the importance of having a pharmacist on your care team and how to best utilize the pharmacist to drive better health outcomes for all of our patients. The pharmacist on your care team uses many strategies mentioned throughout our session today that can help reduce potential adverse reactions or complications. Our pharmacists provide patient education to help patients take medications as prescribed, as well as educate on side effects and how to manage them. Medication counseling to address concerns and questions that patients may have about their medications. And sometimes this actually includes simplifying regimens too, by working with providers to help reduce the number of doses per day or potentially switch to combination medications as appropriate. We also monitor and look at optimization of those therapies. So the retrospective DUR is a technique that's used to evaluate drug claims data to monitor for patterns like overutilization or underutilization. So that way we can ensure those resources are being used efficiently. We also look at improving medication safety. The DUR process that we described today, certainly pharmacists identify potential issues such as those drug interactions, incorrect dosages, or therapeutic duplications before medications are dispensed. As Kristen also described earlier with clinical decision support, our pharmacists do use systems that are in place to help make sure that medications are appropriate, that they're medically necessary, and that they're unlikely to cause adverse effects. This really improves the quality and safety of medication delivery. And then lastly, educational interventions. So our programs often include educational components where pharmacists provide prescribers with updated information to improve prescribing practices. Pharmacists often through DUR programs really act as a bridge between prescribers and patients, ensuring that medication therapy aligns with best practices and patient needs. Our Genoa pharmacies partner with organizations like yours that serve those who need it most to improve outcomes and make life easier for those that you serve. Our model of care is truly focused at meeting the patient where they are in their journey to ensure that they have access to their medication needs at all times and can manage the complexity of their disease state. We offer free medication packaging, such as care packaging, which formerly was referred to as disc pill packaging, as well as strip packaging, bubble packs, and other options. We also help address transportation barriers by offering mailing and delivery services when needed. Our pharmacists are trained in mental health first aid and can help to identify signs of a mental health crisis. Our pharmacists build trust with patients through effective and frequent communication. Our pharmacists help to navigate insurance requirements, including prior authorizations, and help with access to patient assistant programs and copay cards. We also work with providers to find cost-effective alternatives if copays are too expensive. And as we focused on today, we help to prevent drug errors by screening for drug interactions and perform medication reconciliation to ensure patients are getting the most out of their medications. And we collaborate with the care team for comprehensive and coordinated care, including medication administration as needed. We also offer enhanced clinical educational services for a wide variety of specialty behavioral medications. These services are designed to drive better education around therapy expectations and how to manage short-term side effects in drugs with long-term build to efficacy. We deeply value the relationships with our center partner staff. Our pharmacy teams appreciate the collaboration so we can provide the best patient care possible. And now I'll turn it back to Kristen for some quick knowledge check questions.
Thank you, Sarah. So we just want to make sure that we cover the most important parts that we hope you take away from today. So our first question is which DUR type is performed prior to dispensing the patient's medication? you answered A, you are correct, and you get a gold star. So that prospective review is really that evaluation before the medication is dispensed. And just as a review, concurrent DUR is that ongoing during treatment, and then retrospective is our review after the patient received their medication. So true or false, DUR includes both cost-saving measures and patient safety initiatives. Hopefully you identified that as true. So DUR does integrate both patient safety initiatives and cost-saving measures to improve healthcare quality and efficiency. And finally, what role do pharmacists play in DUR? Select all that apply. They help monitor for therapeutic duplications, educating prescribers on prescribing practices, and evaluating patient adherence to medication therapy. So as we've highlighted today, pharmacists play a critical role in DUR by monitoring, educating, and evaluating medication use. While many of our pharmacists can directly administer medications such as LAIs, that is not part of the DUR process. And I will turn it back to Shannon to close us out for today.
Sounds great. Thank you so much. So this concludes today's presentation on drug utilization review. All of the clinical education series presentation recordings are housed on Genoa's website shown on your screen. This page will allow you to access previous educational series presentations and register for upcoming presentations. Please note that the next presentation given by Genoa Healthcare will take place on Friday, June 20th at 12:30 p.m. Eastern Time. This presentation will address whole healthcare for individuals with behavioral health needs and how to better support the family caregiver. Please visit the website to register for this event. If you have any additional questions from today's presentation, please feel free to reach out to Sarah, Kristen, or myself, and we will be happy to answer. Thank you so much for attending. Have a great day.